in your opinion, what is the kind of the best treatment options?
Yeah. First of all, we need to say that these have been revolutionary drugs. They're probably, Viagra, for example, is probably the most famous drug of the last century.
Yeah.
And the developers of it won the Nobel Prize for medicine. So it doesn't get much better than that. So these have been revolutionary drugs. The important thing to realize is that they were developed to treat heart disease, and they were well down the route because we knew they increased blood flow.
Yeah.
And then by chance, they discovered that the patients wouldn't return the tablets in the trials because they noticed this remarkable side effect.
Yeah.
And all this happened in South Wales. This is why
really?
Morrison Hospital in Swansea is absolutely famous, because this is where this was first discovered by a colleague of mine, David Price. And so this changed really the whole direction of the company's development. But we shouldn't forget that they actually knew what the drug was good for in the first place. All right? So that's why these drugs are very good drugs for the cardiac or cardiovascular disease that the patient has causing the problem. And that we shouldn't think of them as just a treatment of a symptom. They're treating the process. And that's what I spend a lot of my time telling patients. And once you tell them that, it motivates them to continue with the treatment because they begin to see other health benefits.
Right. So maybe let's first just kind of compare the options that patients have. So normally we have Viagra or sildenafil, and we have Cialis, or the generic being tadalafil. And then we've got Spedra and Levitra as well.
Yeah.
So out of all those, what do you normally opt for in terms of what you treat your patients with? What is your preference there?
Yeah. First of all, we need to explain why do we have all these different names for them. The reason for that is when a company develops one, they give them a classy name like Viagra because people can remember it. That's what we call a trade name. And then when the patent runs out after 15 years, a load of different companies can make it, and for a lot lower cost. So we then revert to the generic name, the chemical name, if you want, which was sildenafil. And so that's what the cheaper products that are widely used now are. Some patients like to have the Rolls-Royce product and always order Viagra. So likewise, when it comes to Cialis, which was really the second major one to come along, that's now known as tadalafil. So we talk about tadalafil now and sildenafil. The key difference between these two is that whereas sildenafil or Viagra works for about 4 hours, it has to be taken a half an hour to an hour before planned sexual activity. Because tadalafil works for 36 hours, you can take it as a low daily dose, and so you can be normalized if you want. You can be able to have sex whenever you would normally have done. So what you're doing there is you're bringing the patient back to the way they were before they had any problem. Okay. So therefore they don't need to give their partner a wink as if something's going to happen in an hour's time because I'm taking a tablet. Yeah. You go up into the bedroom and be ready when match of the day's finished. That's not exactly the most romantic thing to say. Yeah. But if you take a low-dose tablet and you give your partner a cuddle of an evening, and then she tells you that she's had a dreadful day at work and she's got a headache coming on, you can make a nice cup of tea, give her a cuddle, and you go to bed nicely. And then in the morning, things might just happen romantically. Now, isn't that the way relationships should go, rather than being orchestrated by the need to take a tablet?
It sounds a lot more natural and spontaneous, doesn't it? So just to be clear, we were talking about a lower dose of tadalafil. So this is 2.5 or 5 milligram doses that are taken every single day, regardless. So just taken every day.
Yeah.
So do you think that this is the kind of optimal treatment when we talk about these tablets?
Well, definitely, because as I've said earlier, they are treating the cause of the problem as well. And what we find is that the improvement, rather than if you take sildenafil or Viagra, you find that after a year or two, it might be becoming less effective because you haven't been treating the process. If you take tadalafil, you find that the opposite occurs and the results get better and better because you're preventing progression of the disease process. And it also has another major advantage because it's now licensed to treat prostate problems. And as men of a certain age get older, they develop the need to go and pee rather more often, get up 3 or 4 times at night. It's now shown that tadalafil prevents the progression of prostate problems with age.
Okay. Well, that's great. So you're saying not only are they treating the erectile dysfunction, they're having more spontaneous sex, but they're also having all these additive benefits, which are vascular and preventing prostate issues.
Yes. Right. And tadalafil also is a very useful treatment if given daily to treat premature ejaculation.
Okay.
So we've just written some guidelines on premature ejaculation, and we've actually made daily tadalafil the recommended first treatment for men with premature ejaculation.
Are there any particular side effects that patients need to be aware of when they're on once daily tadalafil?
Well, the important thing with once daily tadalafil, very similar to the fact that if for example, you like a drink and you had 1 pint of beer every day, and then you drove home from the pub, you'd probably be perfectly fine. You wouldn't have any side effects at all. If you went out on a Saturday night and had 7 pints, you'd probably feel rather ill. You'd probably be written off most of the following day, and you might even write off your car driving home or get arrested. Same amount of beer in the same period of time. So therefore, having the low dose of tadalafil daily, you get fewer side effects than taking the big dose to force an erection, if you want, in the next hour or two. So the side effects that we do see are a mild headache, slight flushing of the face, slight indigestion, and sometimes a bit of nasal stuffiness. But these usually they're initially, and they usually wear off with time, the more doses that you take.
So these are things that you would normally see with the other treatments, but just to a lesser extent. And these are all things that are very common with sildenafil as well.
Yes, you rather like the analogy I used with if you take the big dose of alcohol in one go, you get much worse side effects than if you spread your drinking out over a week.
Yeah, that makes perfect sense.